the call is being recorded. Is that correct, Jonathan?
Yes, it is.
Okay, Teresa, I'm not sure if everybody, would you just kind of reintroduce yourself and tell us a little bit about what you do?
Right, so I'm from Alaska, and I'm the state long-term care ombudsman in Alaska. So everybody has an ombudsman, I think, maybe who visits your facility. Our job is to advocate for the wishes of the residents.
Okay. Right. So this is really interesting that you're on the call. When we get to that part of the agenda, I'm going to ask you a question that one of my RNs asked when I was on the unit the other day. She was asking me, and I said, well, I think that's an ombudsman issue, but I'm not sure. So we'll give you a chance to give a little ombudsman report here on the agenda. So I wanted to recap the April meeting. We did have our steering committee meeting in April on the 10th, and then we met always on the third Thursday, so we did have a meeting on the 19th. I also wanted to remind everyone who is currently on our steering committee meeting, or steering committee. So right now, I have Keith and Lisa, who are both QIO, Melissa, Val Crail from Cotton View, Carly and Tammy from Wyoming, and also they added Sunny, who I believe is their HR person, David Hunt, who we haven't heard from for a while, Joseph Ray, Francis Stout, Dr. Blythe Winchester, Shelley Zylstra, who is in Washington, Cynthia LeCount with the Administration on Community Living, and Lee Olitsky, who is a consultant. He was our administrator here and retired back in April of last. So that's currently who I have on the steering committee. In terms of the U.N.I.T.E steering call, that was held April 10th. We had Melissa, Joseph Ray, Dr. Winchester, Val, Lisa, Julie, and Jonathan from KAI. I always forget to put myself on the attendance roster. And so at that point, Julie gave an update on the phone interviews, and I think Jonathan's going to tell us about that today. Lisa was summarizing the results of the SurveyMonkey that she did. We talked a little bit about our June and July webinars, and we're also going to talk about that today because those are coming up. Dr. Winchester was approached about speaking on our April call, which actually she was able to do. I wanted to give you, there was no T-Tag call in May. It was canceled by John, but we did have a T-Tag call on Tuesday, April 11th. So if you remember, we have our meeting, and then there's the Long-Term Support Service Tribal Webinar, and then we have our steering committee meeting, and then there's usually a T-Tag all before our next monthly meeting, which is always the third Thursday of the month at noon. So I didn't get a chance to share this with you on our April call, but on the T-Tag Long-Term Care Subcommittee call on Tuesday, April 11th, I was on that call. They usually ask for an update from our group, and they did mention that there's going on the CMS.gov website, which we all should be checking pretty consistently on the tribal affairs part. They're actually going to have a link there like they do for U.N.I.T.E, and Jonathan, you probably know about this. It's going to be an ITU portal.
What is ITU?
So, Jonathan, am I right? That's Indian tribal entity, or what does it actually mean? It's something tribal something.
And that's a good question. I do not have that exact definition. I will look it up, though.
I know what it means. I've actually... I was on a webinar. ITU is something tribal something, and I can't remember.
But it's a way for a tribal member to have a secure portal entry to information from CMS.
Yeah, it's like for all tribal entities, like there's things that fall under that acronym. Mm-hmm. Like I think I'm thinking the Title VI may fall under that, the food service program. It's ITU. Did you? What is that, Jonathan?
I'm looking it up right now.
I guess my question is just what is the significance for this group? So I'm just trying to understand.
It's another like a link that's going to be on the same like website area as our link to our U.N.I.T.E collaborative. So I just wanted everyone to be aware that this is some stuff that they're working on, that CMS is working on. And then they're working on a video for tribal leaders, so that's significant for what we're doing on long-term and support services. They're going to be like 60-second segments is what they said. And then there's going to be an educational video, the aspects of long-term support service. It's kind of to start the conversation. And my understanding, the script has already been approved. But what they're looking for is a prominent narrator. And I'm not sure that they found anyone. I was actually going to suggest Francis Stout. But back on April 11th, they told me that the beta link was going to be in 1 month.
Okay, cool. That was something to watch for sure.
It's the ITU portal link.
So ITU stands for IHS Tribal and Urban Indian Health Program.
That's what it is. IHS Indian Tribal. What?
Tribal. IHS Tribal and Urban Indian.
And Urban Indian, yes. Okay, I've heard that before. ITU. Okay, so they're going to add that as a link to where the link is for our U.N.I.T.E collaborative. Okay, just so you know.
Yeah, cool.
Okay. And I don't know, just if I gave John Johns, are you getting emails for the T-Tag call?
No, I haven't.
Okay, because I gave him that quite a long time ago and told him to add you so that you could be on those calls too. So I'm not sure what happened with that. Let me make a note here just to add Joseph to T-Tag. Lisa, are you taking a few minutes here for me?
I am.
Okay, thank you. So I just wanted to share one thing. I don't know if any of you caught the webinar last week. It was Dr. Jackie Gray with the National Indigenous Elder Justice Initiative. And she did a live webinar on, abuse in Indian country. And some of it was stuff I've heard before. Some of it's kind of right off their website. But one of the things she mentioned that I wanted to share with you, I think it kind of falls into, like, who we are as a collaborative. And she said that we all talk a lot about what our best practices. But she said we need to think about what she calls evidence-based practices for tribes. So rather than, like, if you go to a conference, somewhere, anywhere, Phoenix, whatever, and, they're talking about this is the best practice for, whatever, some, nursing home in the middle of Phoenix, she's saying that, great, that's a best practice, that's great. But she said, what works for a tribal nursing home? Like, maybe that best practice might not work for us. So she talked a lot about evidence-based practices specific to tribal nursing homes. And that kind of struck me to say that's what we're really about, is we're kind of this little market niche, we're this little specialized area, and we want to be, advocate for what really works for us and be really good at that. And if that maybe we come up with something that works for other nursing homes, great. But we're really about advocacy for our tribal elders, and I think that we don't want to lose that focus. And so I just kind of wanted to share that with you.
Well, and I think the evidence-based piece just usually implies research and data and analysis, and I think we can get there. If we keep on the path that we're on and we do collect some data as we are and we do check back and can show improvement, then we can legitimately say this is a best practice, this is our methodology, et cetera, et cetera. Right now we're just sort of gathering what we believe is helpful. And I think we're on the right track, but I think as we keep moving forward, we'll get there.
Right. And part of research, as you know, sometimes you do very subjective, interviews, but you gather a lot of information that way. So it might not always just be sheer numbers, but what people say. And at some point, I don't know how all of you feel about this, but at some point we may actually interview some of our elders, to get that information too. So
I think that's great.
Okay, hold on a minute. Sorry. Okay, so now are there any administrators on the call? Because this is where we usually do the administrator report. Are there any administrators on the call? Okay, I didn't know if Val was going to. If any administrators join the call, please let me know. I'll keep asking, and we can have them do their report. The only comment I had from Lee Olitsky, who was our former administrator, was that, maybe we should be talking about some of the mega rule stuff that goes into effect in November of this year. One of the things that I'm working with Arizona Healthcare Association is with our disaster preparedness plan, because on our last survey in April, we had some K-tags that we're having to work on. And that plan is super important. I don't know if any of you use the compliance store as a resource, but we've been using that, and they actually have like a binder and a formatted PDF where you can create your disaster plan right on that and then just flip it right into these kind of tabbed, a special binder. You can actually put it on the wall, and it's super easy to flip through for the staff to see your disaster plan once it's correct. We're also part of our statewide coalition now to do like a major disaster training, which is required. You can do it yourself, but it's easier to do it with someone else sometimes. The other thing I wanted to mention is week before last, if you didn't catch it on the news, we had a huge power outage here on the nation, a good example of a disaster. And we had no power. We were on backup emergency generator for 2 days, 48 hours. And we had a fire that happened in our housing for our staff because I think it was related. My understanding is it's related to a situation where the power went out when someone was cooking, and I don't think the stove or whatever got turned off. And so when the power came back on, nobody was in that apartment, and it caused a fire. So there's things that are happening. I know that Ohio, if you didn't hear, had a shooting at the nursing home in Ohio where a nurse, the CNA, and the chief of police were killed related to domestic violence and an active shooter situation in a nursing home this week. I think that just happened on Friday.
Yeah, I heard that.
It was very eye-opening for our staff because we had just done our lockdown drill. We had our police out here on Thursday and had done a lockdown drill, and then that happened on Friday in Ohio. So I don't know how many of you are doing lockdown drills. I know that can be a little bit scary to think about, but in truth, I think it's something that, at least for us out here, we feel like it's something we have to address in our disaster plan. Does anyone have any thoughts on that?
Well, this is Lisa. We got a lot of guns in Alaska, so I think it's certainly something that I don't know if our nursing homes are actually doing active shooter drills. We've talked about it, but that's something to bring up for sure.
I'm happy to act as a resource because I got pretty involved in that whole process of setting up drills for our lockdown and thinking that through a little bit. So I'd say the starting point is meet with your police because they're already doing this probably in schools and things like that. And we had them initially come out and do like a presentation with our disaster committee, and then we just kind of started tweaking what they said and making it appropriate to the nursing home. But you have to train everyone because we have a lot of new people, and a lot of them had no clue. I mean, they had no clue what to do. So, and the other thing I've learned is it's very different from fire training. So when you do your fire drills, you want people out finding out what's happening. When you do your lockdown, you do not want people out. So it's completely different from a fire drill. And so you really have to stress the difference between a lockdown drill and a fire drill. Okay, I don't want to do all the talking here. Is Rebecca Drummond on the call? Okay. So Rebecca did a little grant update on our last steering call. And just so you all know, we should hear something soon. There was a little bit of delay because of, federal monies being kind of held back. And so there was some kind of delay. And I'm sorry, I just didn't get a chance to call her before this call to ask her if she had heard anything. But I'm sure if we get that development grant for this collaborative, like I said, it's $100,000. It's supposed to go into effect June 1st, but because there's been a delay, it's probably going to be maybe even July 1st if we do get it. So just keep thinking about that, because that would, I think, really move this collaborative along. It would pay for our annual meeting and help us develop some strategic plan, which I think would be really helpful at this point. So as soon as I hear something from Rebecca, I will let everyone know. And so, Jonathan, do you want to give us updates on the webinar or anything else on the website?
So as you come right in, I'll start with the website. As you mentioned before, this ITE portal that we are creating is really supposed to help make navigating the TA Center a lot easier on CMS.gov. We really want it to be more interactive, more user-friendly. We want people to be able to find exactly what resources and research that they're looking for. So that's the plan, and that's the purpose of developing this new ITE portal.
Okay.
Definitely.
So there's not really content there?
Well, there will be content there. So what we plan to do is the layout of the TA Center will change, that homepage, but everything will be categorized a little bit better. And then at the top of the page, there'll be a section that is specific for new materials and new resources and new products that we've created. So, like, whenever we post something new, let's say when we finalize the best practices for the collaborative, there'll be the link for the best practices under the new resources or new product section. We're still tweaking with the names for the section. But there will also still be the link for the Nursing Home Collaborative section. That's not changing. We're just making it easier to navigate.
Okay, great. Okay.
So that's that update. So as far as the best practices are concerned, we have 3 nursing homes that participated in phone-in reviews. Excuse me. And 2 submitted written responses. And we have 2 more folks that will be...
Not our 5.
Yeah, we did. And we actually have 2 more that are going to be submitting written responses by the end of this week. So then that'll put us over the 5.
Excellent.
So yes, so thank everybody that reached out and participated and spread the word. That was helpful.
Okay.
We're still going through the transcripts from the interviews and the responses to the questions, but it's due to seeing this on the 1st. So Debbie, we plan to send it to you on the end of next week to take a look at it.
Okay, so that's for the best practice paper that's due June 1st?
Yeah. Mm-hmm.
Okay, and then you'll just want a couple of us to eyeball it and give you some feedback?
Yes.
Okay, I'm just going to let you know I'm going to be out of town Wednesday, Thursday, Friday next week, and then Monday, Memorial Day, just so you know.
Okay.
If I can, I'm going out of town, so I'm not promising that I'll be able to look at it. But if you can get it to me by Tuesday, I'll definitely look at it. Okay.
And as long as you can take a look at it by the 31st, that'll still give us time to make any edits that we need to and submit to CMS.
Okay. First. I'll log in, but if you can get it to me Tuesday, that'd be good. If not, I'll just have to find time to do it. Okay.
Okay. Yeah, well, I will definitely Julia will let you know, either Julia or I. And the only other thing that I had was the webinar. So the topic for the June webinar is on dementia care and travel nursing homes. And we decided there was going to be a panel discussion for the format. And we're looking at having panelists from different areas of operation for the nursing home. And initially, the list that we came up with as far as people that were going to participate in that panel were you, Debbie, Jordan Lewis, Dr. Winchester, Val, and then we had mentioned another board member, but we didn't have a name for that board member.
Is this the one in June?
Yes, this is the one in June.
I have Dr. Jordan Lewis, Dr. Blythe Winchester. We wanted a nursing home administrator. We had talked, Val, I think, had said he might be willing, Val Creel. And then we wanted a director of nursing, if possible. I'm happy to do it. Lisa, do you think that Liz Lee would be willing to be on that panel? Because we have to set a call up probably for next week to get this together pretty quickly.
I'd say a couple of thoughts on who we've got on the panel. One is Val, who has done a lot for this group. My only comment is he's very difficult to hear on the phone and in presentations. I love the guy, but it's come back as feedback. I've had him speak for me a couple of times, and it's always something that I get feedback on. And like I said, we might, if we can get another administrator that's got a powerful presence, that might be better just for the airwaves. Like I said, it's just hard to hear. There's nothing wrong with how he speaks or what he's got to say, but he's just a very soft-spoken person, and that can be a challenge when you're trying to do things over the airwaves.
I tend to agree. Is Liz? What do you think about Liz?
Well, the challenge with Liz is she can be a tough, in my experience anyways, can be a tough one to get at the table. I know she's interested and enthusiastic and willing. It's just whether or not she's got the time to carve out for this. I don't know. But also Mary Ann Bornachella in Cleonacare and Nome, she's not been on the calls, but I know she's got a lot of experience. She's a seasoned nursing home chief nurse, whereas Liz is new. But Liz is also Alaska Native, which is really nice because you've got that perspective. So Liz would be fantastic if we can get her to commit, if she's got the time and is willing. And then, like I said, I think if that doesn't work, that Marianne from Nome would also be a good suggestion. I know they don't have a permanent DON in Kotzebue right now. They've got a temporary, so I'm not sure that it would be right to invite her at this time.
Okay, so Melissa, do you have any interest in being on one of these webinars, or would you like to maybe look at the one in July on tribal relations? How do you feel about this?
I thought I was participating in the one on July.
Okay.
Yeah, either one. And yeah, it would be ideal to have Liz Lee on the phone. Just, even though she's a new director of nursing for the nursing home, she has a wealth of experience in relation to rural areas, and that the challenges with providing long-term services and support to the rural areas, especially for her region.
Okay. And she'd be okay with dementia. I mean, I think between Blythe and Jordan and Liz, and Tammy said she's an administrator now. I don't know if you all realize Tammy passed her test at Morningstar, so she is their current administrator. So we could probably get Tammy as an administrator, Lisa.
I think that'd be great.
Okay. So that would be a really strong core. I'm happy to be there, too, as more the educator talking about that piece of it. So Blythe, Jordan, myself, Liz, and Tammy. Is that sound like a good group, Jonathan? That's 1, 2, 3, 4, 5 people?
Yeah, I think that sounds good.
Okay, so I think we need a call, though, an initial call with those 5 people, probably next week, Monday or Tuesday. What do you think?
I think that should work.
Can you set that up and send out an invite, please?
Yes.
Just send it to me.
Okay.
And let me, just pick a time and a day. Send it to me, and I'll see I'll send something out to these 5 people and see what I can do with that. Okay?
Okay. Is there a time that works better for you?
Yeah, let me talk about let me talk to you after the call. But the other thing is, just stay on the call when everyone hangs up. And then July, too, I think we need a time set up now in June for that group of folks. You know what I mean? So we're thinking ahead here. When's the date on July again? It's the 28th?
Let me look at my calendar. I think it is the 28th.
So it's always the fourth Wednesday, correct?
Mm-hmm. And that is
26th.
26th.
It's 26th. So it's June 28th, but July 26th. Okay.
Right.
Alrighty. All right. And can you give us any feedback, Jonathan, on when we talk about what you're hearing so far from the interviews that you have done?
I haven't actually conducted any of the interviews. Julie's been handling all the interviews. But from my understanding, we've got a lot of quality information from the administrators. I'm actually waiting for them to finish writing the report so that I can review it.
Okay. Because I think we're going to need that. We're going to need that for the July webinar, right?
Yeah. Oh, yeah. And we'll have the report done.
Good.
And it'll be a good reference, and we can send it out to everybody.
And that will be also our best practice paper, which will be posted June 1st. And then the next one in September will be on dementia again, correct? The best practice paper?
Yeah.
Okay. Okay. Anything else, Jonathan?
I mean, we've already kind of mentioned the July webinar and what it's on. So it's just we just need to identify who's going to participate in that one.
Yeah, and I think I've got some notes, and I'm trying to remember who we said. I think we did talk about that already.
I'm pretty sure Joseph Ray was one of the ones, because I know he had shared that there were some changes going down, and that would be good timing for him to share how things flushed out. But Joseph, you're on the call. Does that sound right?
That sounds right. And again, we have a new administrator here at Lagunas, and it's been really a challenge to update her on how the relationship goes with the tribe, especially regarding our capital outlay funding. We really need to stay involved in that process, because if our building's 30 years old and it really needs to be maintained well, and so I'm hoping that Miss Wiggins will be on in the future. Her name's Sheila Wiggins. She doesn't really have any tribal experience, but thanks for that mention, Lisa.
Hey, Joseph, is it WIGGINS?
It is.
Could I get her email?
It's S. Wiggins, SWIGGINS at LagunaRainbow.org.
Thank you. Do you mind if I reach out to her?
I don't mind. Julie was to have reached out to her, but I never found out. I never heard back from either Julie or Sheila. So I don't think they had spoken yet or contacted each other through email. I did introduce them, but I never got a response back from either. So,
Julie, you mean Julie Cahoon with KAI?
Correct, because again, Julie wanted to interview Sheila as that tribal administrator as part of our survey that we were doing, but I don't think they ever hooked up. I have a board meeting next week, so I'll ask Sheila about it.
Hey, Jonathan, can you please follow up with that? If she's not one of the 7, maybe we can reach out and see if we can get 8.
Sure. I'll check on that.
All right. And then I'm going to have, thank you, Jonathan. Lisa, do you want to go ahead and give a little QIO update and talk about I know you sent me the results for the 5, interviews you did, or the Survey Monkey, where they answered the questions that we came up with, the Dementia and Board Relations.
Yeah.
But you also did the dementia. Can you talk about the little dementia project in Alaska and what you've learned from that?
Well, I'm excited, but we're still in the very early stages. That we've pulled together a dementia work group, and sort of the main goals of this group are, number one, to have a dementia certified trainer in each of our nursing homes. So of course, to do that, you can't just do like a one and done training. We want to embed an ongoing training program in our state so that, a year down the road or a couple of years down the road, we have 18 nursing homes that have a train the trainer in their facility.
Okay.
Another piece of that is to work on a culturally appropriate tools and assessment, sort of a toolkit and of course it's our tribal nursing homes that are going to probably be leading the way on this. But as I've always said, we have Alaska Native elders in all of our nursing homes. So to me, this is something that is a statewide initiative, but will probably be led by my tribal nursing homes for just things like pain management, communication, end of life, some of those difficulties in respecting culture. If you're a travel nurse and you're just plunked into the Kotzebue nursing home tomorrow, how do you know some of those basic cultural elements that are critical to our population? So we're hoping that we'll have a good toolkit to come out of that as well. And then the last piece, and this is a little bit of the shakier one, is they want to impact at the state training level so that CNAs who are graduating our different programs here have robust dementia training as part of their core curriculum.
Wow. Okay. Excellent. Okay.
That's what we're doing in Alaska, and of course we'll be sharing. And to me, one of the things where the collaborative, this will overlap with our work in the collaborative, especially as it relates to dementia care, is some of those sort of the template that we look at for the cultural dementia care piece. So say pain assessment. That's going to be different all across the nation in terms of culture and the nursing homes, but so you and Laguna Rainbow, what's important for people to know about pain and assessing your residents? At Archie Hendricks, you've got a different population. What are some of the nuances of pain for your population? So I think we can come up with sort of a template that can be, applied. It'd be blank, but you can fill it out for your particular cultural group and find out what are some of the important elements for a caregiver.
And I think having that template is really, it's like thinking it through. It helps us think it through. So it's just like with traditional food. What was our starting point on that? The starting point was, you have to talk to your elders or your population and find out what is it that is important to them. It really has to start with that. Mm-hmm. So this is almost kind of like drives your assessment, correct? I mean, in a way. Okay.
And we'll share as I am able, but that is where we're at. We've only had one meeting, and actually it was after the meeting that I realized I was herding cats and needed to break into work groups because it was just everybody had a slightly different agenda and a slightly different need, and so I just had to sort of split things out and put people in sort of smaller work groups so that we're not bogging people down too much. But I'll continue to share.
So, Lisa, you really haven't actually surveyed these nursing homes in Alaska yet?
Well, the Survey Monkey that I did on dementia care is part of what will help, and I'm trying to pull it up right now, will help our guide where we go. So, like understanding who has memory care units and what kind of training they do now, what kind of training education on the tribal nursing homes.
Right. Is that the one that you sent me, though, the one that there were just 5 of, where you sent me the results of that, Tribal Nursing Home Survey, Dementia and Board Relations? Or are you talking about something different right now?
This went out to all of my nursing homes in Alaska.
Okay. And so this is also to everyone on U.N.I.T.E or just to your tribal nursing homes in Alaska?
Just to my because it was a much longer and more specific to this group question. So, for example, like one of the questions was, please rank the following in terms of priority for Alzheimer's and related dementia needs in Alaska. So was cultural understanding of the disease important? Was development of culturally grounded programs and services important? Some of these are Jordan's questions. Development of new policies and procedures to meet the needs of this communities, or research and data collection. So, you know, this is very specific to our state. Yeah, it was a lot of it. I pulled these questions. I think I'm looking at them again. They're almost all from Jordan. But, you know, like, what have been your greatest successes working with residents who suffer from dementia? And we'll be able, and there's a whole lot of very specific cultural questions that were included. But overall, the Survey Monkey that I sent to my group will just help us have an understanding of, number one, where they are currently, what they have, what they don't have, and what they need.
Okay, so here's a question. I have not seen those results. I think it would be helpful if you could kind of summarize them and we could make them part of our PowerPoint for the webinar. What do you think about that?
I think the caveat that these aren't all tribal nursing homes.
Right.
You know, this is, but as I always say, there's, you know, elders. We're serving Alaska Natives in all of our nursing homes, so I'm sure it's reflected in some of these answers, but I couldn't say that absolutely.
Right.
But I'll send you the summary stuff. Yeah, I can share that with you.
Okay, that would be good, because I'll probably be doing the PowerPoint is what I'm thinking. Mm-hmm. You know, with some editing from all of you, I'm going to need some help with that. Okay.
Yep.
I'd like to see a slide added. I guess maybe it comes under board relations, where we keep raising the fact of that we're one of our facilities are only 18 strong across the nation, and that we're keeping fighting for our elders' rights to age in their own communities. And we're thankful that there's facilities that take them in the cities, but again, and I guess we'll never reach that point where we can provide all the care that our elders need in their home communities. They're going to need that acute medical care, but again, you know, that's one thing I think we need to emphasize, because I'm trying to think what my role is with this group still. And I guess it's always going to be, as a community member, fighting for resources for our elders to, as long as they're able to remain in the community.
Yeah. Keep that focus. Yeah.
I was going to say, I know that's Jordan's focus as well, even though it's broader than that. But I know that really his, at least as I've talked with him, and I'm speaking for him, of course, but just in our conversations, I gather that his passion is really in how do we build communities that are able to care for their elders with dementia as long as possible, aging in place. And then, of course, when, you know, there are issues where they just can't do that safely anymore and they come into our nursing homes, then how do we continue that supportive, culturally supportive care? And I think that's why Jordan is kind of along on this journey. And I see the same for you too, Joseph.
Thank you.
Yeah,
you're stuck with it.
Yeah, I think what you're talking about is really the foundation of this collaborative. And we do not want to lose our focus. We do not want to lose our roots and what we're all about, because then we're just kind of floating around. So we don't want to do that. So all this stuff that we're doing and PowerPoints and webinars or whatever, we don't want to lose ultimately what we're trying to do, which is what you're talking about. We're part of this long-term support service continuum, and we want elders to, you know, like Lisa said, build community, age in place, culturally supportive care. We're part of that continuum. You know, we're not about dying. We're not about dying. That's not what this is about. I mean, it could happen, but it could happen at any point. So, we're about that continuum of care. It's in there and going on soon. Okay, so, I'm sorry, James. Yeah, about 10 minutes. I'm sorry. I meant to call you 1 o'clock. Sorry. I have to finish this call, just like 10 minutes. Sorry. Yeah. Okay, sorry about that. I know we're almost done and we're almost out of time. Teresa, would you like to give the ombudsman a little update there?
Well, so we just had our ombudsman meeting, and it's always interesting to chat with my fellow state ombudsmen to see how aware they are of the tribal nursing homes and in their state. And I'd say there's a few states that are aware, but when I looked it up, I think there was like 12, 15 states. Anyway, so that was interesting for me. But the main thing that's going on in the ombudsman world right now is this whole implementation of the new nursing facility regs, and specifically the discharge notices.
Okay.
That have to be sent to the ombudsman.
Are you talking about the facility-initiated discharge?
Mm-hmm.
Okay.
And so that SNC memo came out, I'm not sure when because I've been out of the office for 2 weeks, but I think it came out last week, that sort of clarified that it's not all notices, but that it is the facility-initiated discharge notices.
Okay.
And then it also clarified that if somebody is transferred to a hospital for medical reasons and they're not going back, they also must receive a discharge notice, and the discharge notice must go to the ombudsman the same day that it goes to the resident. So that's been a big project that we've been working on, and it's a new thing for both sides, I think, and so it's causing some difficulties.
Uh-huh. Anything specific? Because I have to teach on this, so we just had our survey here. We're surveyed federally in April, and that was one of the FTAGs that we got cited on, and I'm doing some training right now on that. So if you had to do training with your nurses on the unit, what would you tell them?
Well, I think that anything that's a facility-initiated discharge, so basically it's anything except residents saying, I'm leaving in 3 days or 5 days or 30 days or whatever, then to be safe, I would give a notice. Some states have a form. Our state's form is still in draft, so I don't know. Lisa, I think we could share it in draft. You could take it and make it your own.
Okay.
We stole it from Florida. I think that
is that
might
the one
help.
that Brenda's is that the one that Brenda's got with council or whatever right now?
Right.
Yeah, okay.
And I think we could share the draft.
Yeah, for sure.
Make it their own. And then there's been some concern, like some states were getting every discharge notice.
Okay.
Somebody passes away, they were sending discharge. So that S&C memo clarified it's only facility-initiated discharges. And then with the exception of that, folks who transfer to the hospital, if they're not coming back, they also have to receive a discharge notice. And then when do you send it? And the answer in the S&C memo was you send it the same day you send it to the resident, you send it to the ombudsman's office.
And
so I would suggest checking with your state ombudsman to see, because every state has sort of figured out a different way. In Alaska, people fax it to our office, to the state office. In larger states like New York, California, Texas, some of those other states, they have said no, send it to the local office. I know in Ohio, even though they're have a lot of nursing homes, they want it all in the state office. So check with your ombudsman to see how they want it. Some states want it by fax, some want it by email.
okay.
So, you need to find out what your state is doing and how they want it. Literally, some states can't afford the paper of receiving all the faxes. In Alaska, that's not our case. But so definitely, and understand that it's stressful on both sides, trying to figure out how to make it work.
Okay. Now, I appreciate that. Does anyone have any questions for Teresa? Because that is brand new. That's in the new mega rule. So it is, and surveyors are citing on it as evidenced by our survey. So any questions for Teresa on that?
This Lisa, I was just going to suggest that the partnering that Teresa, the head of our state agency, and myself, I think has been super helpful both for everybody, because the nursing homes are kind of getting the same message three ways. They know they can call Teresa if they've got questions. They can call me. I'm actually just pushing. In fact, today, Teresa, I just placed the order button for 100 posters, laminated posters that Mountain Pacific will be sending out to our nursing homes. And actually, I was going to give some to you, too, to hand out when you're doing your thing. Just, again, it's a tool for the nursing homes to make sure they've got the right information. And this is more around grievances and stuff. But the fact that, I think partnering gets you the same message, make sure everyone's on the same page, and you move that ball down the field a lot longer.
Right. I'll check with Keith on that, too.
He may be able to offer some help.
Right. I'll ask him. That'd be good. Okay, so QA is really important. Okay, just to wrap up then, check our website, check cms.gov. I've got some outreach to do to our new members. Again, traditional foods, we said we'd keep that on the burner. So, if you are doing some stuff with traditional foods, share it. Send it to me and I'll send it out to everybody so we stay up on that. Read through our best practice paper once in a while. Remember what we said was a best practice. Melissa, let me know about a possible place for our annual meeting, which would be in October, right, Melissa, with NCAI? Is that October?
I believe so. I'm still looking at, what's going on around that time. You could also, just come up here to Alaska and attend the Elders and Youth Conference. It's in Anchorage this year.
Okay.
I don't know I'll continue to look and send you information as I find out.
Where's the dates on the Anchorage one?
For the Elders and Youth Conference?
Yeah.
It's the week of October 23rd.
Okay. All right. So something I want everyone to keep in mind, because if we do get the grant, we will definitely be doing a strategic planning annual meeting, probably a couple-day meeting. And so we'll have to think about where we want to do that. Just if you didn't hear at the beginning of the call, Randella Bluehouse and Cheryl Archibald with NICOA, they are moving their office, so there'll be a new address. It's still in the northeast part of Albuquerque, but that's happening on Monday. Also on the web, I'm forwarding the elder care provider sheet and the care partner sheets with the link to all of those resources. So please, please take advantage of all those recorded webinars. They're all on aging, and they're all really good. So I download them to my Google Drive and use them in training. And I actually created a binder I leave at the front of the nursing home with extra copies of those care partner sheets, so families can take them if they want them, that kind of stuff. So feel free to access that as a resource, okay? All right. Anybody else? I think we're almost done here. Anybody else have any comments? Okay, so our next steering call is Monday, the 12th of June, and that's at 11 o'clock Arizona time. And June 21st, which is a Thursday, third Thursday at noon, will be our June call. So in between that, obviously, the group that's going to do the webinar is going to be hard at work because we'll have to have that together by then. So, okay, thank you all. Thank you for attending. I appreciate everyone's, everyone contributing, and it's really nice to hear everyone's voice.